Alright, often what follows the abnormal psychology chapter is the methods of therapy chapter, chapter 12. Okay? And I often teach these kind of together, because once you talk about disorders, your next question is, well, how do you treat disorders? Now, when you look at methods of therapy, there are several different methods. Psychotherapy is mostly based on the interaction between a trained therapist who's using psychological techniques and a client who's experiencing emotional or behavioral or interpersonal problems. Psychotherapists have PhDs in clinical or counseling psychology. Now, the eclectic approach is basically uses a variety of techniques based on the symptoms that are shown. In other words, they don't use one approach just because they're trained in one approach. They use a variety of approaches. Now, insight therapies involve an engaging dialogue between the therapist and the patient with the goal of having the patient gain insight or an understanding of their conflicts and development of a possible solution. This is probably what most of you would imagine therapy is. It's a conversation between a therapist and a client. Now, behavioral therapy focuses on learning. Behavioral therapists have this idea that what was learned can be unlearned. So if you learn to be afraid of something, you can learn to be you can learn not to be afraid of something. Biomedical therapy uses ECT therapy or electroconvulsive therapy, medication, or other medical procedures. Now, this is the key thing you guys got to remember. This is often the work of a psychiatrist. Psychiatrists have a medical degree, which allows them to prescribe medication. Often, psychotherapists do not have a medical degree. They have a PhD in clinical psych. Now, here's a typical question you would see. What type of therapist has a medical degree and therefore is able to prescribe medication? Most of you would say that's a psychiatrist. Okay? Now, the first type of therapy we're going to talk about is psychodynamic psychotherapy. Now, this was Freud's area. And Freud basically established what was called the psychoanalytical thought or approach to understand why some patients who were experiencing blindness, paralysis, or other symptoms and had no physical causes were displaying these things. In other words, they had conversion disorders. In other words, they were blind, but there was no damage to the retina, there was no damage to their eye. There was some psychological trauma that occurred in their life that caused this. Now, he was amazed how many of people that he treated had childhood psycho memories or trauma things. Now, he concluded that these resolved from childhood issues that were repressed or pushed back into the unconscious. That's always key with Freud. In other words, people that went through these terrible things in their childhood did not deal with them, they just repressed them. They pressed them down. Now that happens without often their awareness. So they're not aware of why they have these types of thoughts and memories. Now, there's several ways that you can basically, what Freud thought, that you can reveal the unconscious. One was Freudian slips. In other words, somebody would say something in the middle of their conversation that they didn't mean to say. So in other words, they're consciously talking and then something slips from their unconscious. Psychoanalysis is then aimed at revealing and resolving conflicts within the unconscious. Now, typical question you would get, psychoanalysis is a method. Which one of these best aligns with psychoanalysis? Now, you always look for the unconscious, which you see right in the first sentence. Okay, treatment that helps patients gain an understanding and possible resolution of conflicts within the unconscious. Now, other areas of psychodynamic therapy. Traditional psychoanalytical approach is first based on helping the client gain insight into their conflicts, then showing how these conflicts affect their thoughts and actions. Now, clients may have to meet with the analyst several times a week over the course of several days. Now, back to yours. Now, when I say several times a week over the course of several years, usually people see a psychoanalysis for the majority of their life. Now, some of the techniques involved in the psychoanalytical approach, free association, the client or the patient says whatever comes to their mind, uninterrupted. So in other words, the therapist sits back, usually in a chair where the client's on a couch, and the client will talk about whatever and anything. And what really the therapist is looking for is Freudian slips, for things to kind of pop into the conversation. In other words, things they repeat over and over, but they're just not aware they're repeating them. Like, for example, the issue of their father keeps on coming up through the conversation. Now, interpretation is simply the therapist offers insight and gives explanations to the client's thoughts, remarks, and actions. Often what will happen is they'll ask a question at a particular time that might bring up a different dialogue within the free association. Now, resistance is a big one. It's when the client unconsciously tries to block the process of revealing repressed memories. In other words, they're not even aware that they're not discussing their mom, for example. They haven't talked about their mom once in 6 days or 6 hours. And when the therapist often will say, why don't you talk about your mother? They will often say, well, I have been. All right? Because they're just simply not aware, they're not discussing. They're unconsciously blocking it from coming into the dialogue. Now, dream interpretation, which we talked about in the States of Consciousness chapter, involves identifying and separating the manifest content, which, if you remember, manifest means what you can remember from a dream. Man, I had a crazy dream. Latent content refers to the symbolic part of a dream. Now, that's what Freud would be interested in, is the symbolic part of the dream, because that reveals the unconscious. Now, we already talked about Freudian slips, but transference is another very important technique psychoanalysis rely on. This occurs when the patient unconsciously, again, they're not aware of it, they unconsciously respond to their therapist as simply the thought that he or she was a significant person in his or her life. And when I say it's the most important technique, often what will happen in transference is, if they have some type of anger or some type of unresolved issues with their father, they will often transfer that unconsciously onto the therapist, where they almost believe the therapist is their father. And when they do this, they'll let out these emotions that are often reserved for this person. They were hidden from the person. So they respond to the therapist as if the therapist is this person in their life. Now, the process in psychoanalysis in which a patient reports on whatever thoughts, memories, or concerns come to mind, that's when they talk freely, a good way to remember it. That is called free association. Now, another question from the psychoanalytical camp. In psychoanalytical session, the following dialogue demonstrates which term. Psychoanalysis, why don't you tell me more about your mother? Patient, you were never there for me. Why would you do this thing? So in other words, they're simply putting their emotions onto the therapist. And again, the way you remember that is they're transferring their emotions that were meant for their mother onto the therapist. Now, contemporary psychoanalysis. First of all, traditional psychoanalysis is practiced today, but not as much because it's too expensive and time-consuming. Remember, this is years of therapy, and a lot of times people can't afford it. Really, where you see psychoanalysis is, upscale areas. Okay, like your Beverly Hills areas where people, one, have a lot of time on their hands, and two, have a lot of money to simply, pay for this. Short-term psychodynamic therapy emerged as simply a modern type of psychoanalysis. Clients get a quicker diagnosis, are not required to go more than a few months, but the emphasis is still the unconscious. That's why it's classified under psychoanalysis. Interpersonal therapy is another type of psychodynamic approach that rather focuses on current problems instead of spending too much time in childhood. Remember, psychoanalysis, they'll spend years in therapy just talking about childhood and how things from childhood affects them. Now, humanistic psychotherapy is the next type of therapeutic approach. Humanistic perspective emphasizes striving for and reaching human potential, being the best human you can be. They believe people are inherently good. In other words, everybody is born good. And if you fall into the bad side, then something happened in your life to cause that. Now, humanists believe a person's self-concept, which is their thoughts about themselves, is the most important feature. And given the right environment, the self-concept can grow positively and simply develop into the best human they can be. Now, the therapy is not aimed at curing the individual, but at helping them rediscover their goodness, okay? Or rediscovering the thoughts and behavior that will further continue. Therapist tries to establish sessions, and this is important, that allows the clients to discover their own thoughts and solutions to their problems. This is the one type of therapy that the therapist is really secondary, and the patient basically directs. Okay? Now, you'll see as kind of an example of that is client-centered therapy. First of all, this was Carl Rogers' big thing. And he was once a psychodynamic therapist, but disagreed with the role of the unconscious. So he simply developed into a humanistic psychologist. And Rogers wanted to establish a therapeutic environment that encouraged growth and self-discovery. Now, we refer to this approach as client-centered or person-centered therapy that relies on 3 guidelines by the therapist: unconditional positive regard, empathy, and congruence. And again, the aim is that the patient's going to direct the session. And since the patient's going to direct the session, the patient's going to discover their problems as well as their solutions. Now, what Roger said is these three characteristics will make this possible. Now, what are these three characteristics? Well, first of all, who developed client-centered therapy? Mr. Rogers. He wants to be your neighbor. He's a nice guy. Now, the three characteristics in this nice little handy chart for you guys. Unconditional positive regard is treating the client as a valued person who has the potential to play an active role in their own discovery. It involves listening to the client without being judgmental. Unconditional means you accept the person, no matter what they've done or who they are. Now, empathy is utilizing active listening. Therapist tries to see the problems from a client's perspective. Empathy, to show empathy means to put yourself in somebody else's shoes, to understand why they may be saying this or why they may be experiencing this. Now, often what they'll do is a technique of reflection. It's an example of active listening, which simply, all as the therapist does is repeat exactly what the patient was saying. So in other words, here would be the dialogue, okay? It's this pretty much simple. Patient says, I don't think anybody loves me. Therapist says, well, tell me why you don't think anybody loves you. They basically repeat it back to them, okay? Now, congruence, which is also called genuineness. The therapist tries to be consistent with his thoughts and feelings. In other words, doesn't show a change of emotions. Doesn't get upset when the patient, talks about one problem of his life. In other words, the therapist is very stable throughout this whole process. Doesn't show a lot of emotion, excitement, disappointment, but is simply genuine to the person that they're listening to. Now, Gestalt Therapy is a form of humanistic therapy which was discovered by Fritz Perls and his wife. Now, remember, Gestalt psychology deals with perception. They believe the whole is greater than the sum of its parts. Now, they believe people are actively processing information from the environment, resulting in their own version of reality. Remember, this is about perception. This version either promotes or hurts their psychological growth. Now, the goal of this therapy, Gestalt Therapy, is to make clients aware of their environment through questioning if what they are saying is not or is consistent with their active, realistic approach. In other words, what they want to do is, some people live in a fantasy world. They believe that everyone likes them, which in fact maybe that's not the case. So Gestalt psychologists try to align their thought process or their perceptions with reality. Okay? Now, positive psychology is a modern type of insight therapy. Remember insight therapy try to gain control or insight into people's life. Now, when you look at positive psychology, this is the latest and greatest in terms of therapy. They are on promoting human strengths, enhancing personal growth and self-acceptance, developing a more favorable outlook in life. Sports psychology falls under positive psychology. They want to remain positive. Obviously, a lot of us have negative events in our life. Positive psychologists want to emphasize the positive things. They want to emphasize don't forget what you have, rather than focus on what you don't have. Now, two types of positive psychology, well-being therapy and positive psychotherapy, which is Martin Seligman. And Seligman was your learned helplessness. He wants to help people not give up. Learned helplessness, by definition, is people have a tendency to give up after 3 or 4 times of failing. Both use the ideals of positive psychology, and they have been good at treating mood and anxiety disorders by focusing again on what people have instead of what they don't have. Now, behavioral therapy proposes that psychological problems originate from learned behaviors. In other words, you've learned to be depressed, you've learned anxiety, you've learned, bipolar, things like that. Now, this includes the ideals of John B. Watson, Pavlov, Skinner, and Albert Ellis. Now, the 4 steps of effective behavioral therapy are: behavioral therapist establish a productive client-therapist relationship. Therapist identifies negative thoughts and behavior, which is step 2. Therapist then becomes a teacher or mentor demonstrating positive learning techniques. And step 4 is the therapist continues to monitor the client's progress, often reevaluate. Now, that might not mean much, but until we actually see it. Now, Susie doesn't like to make speeches. Every time she gets up in front of people, she starts to shake and becomes increasingly nervous. Which therapeutic perspective would explain Susie's response as a result of negative associations? And that would be, most of you would say, would be letter B. Okay? Now, behavior therapy is divided up. Behavior therapy emphasizes classical conditioning. Behavior modification emphasizes operant conditioning. And cognitive behavior therapy addresses thoughts and behaviors associated with the problem. Cognitive obviously being thoughts. Now, behavioral therapy that emphasizes classical conditioning. Pavlov demonstrated that a dog, through repeated pairings, could learn to associate the ringing of a bell with food, which we talked about in Chapter 8. This could eventually lead to the dog responding to the bell. Watson showed that associations can also be made through stimuli and emotional reactions, such as little Albert's fear of a white rat associated with a loud noise. Now that type of understanding has led to simply counter-conditioning or therapy that emphasizes classical conditioning. Now Mary Colbert-Jones questioned whether a learned fear can be unlearned, okay, or not learned anymore. Counter-conditioning is learning a new conditioned response that is more effective than the original learned response. Here's a good example. Okay? Jones worked with a boy named Peter who was afraid of rabbits. Now, to prove the effectiveness of classical conditioning, she used Peter as her subject. First, she brought the rabbit into the room. Far enough from Peter would not cause fear. Now, again, the fear is a conditioned response. He learned to be afraid of a rat, or afraid of this rabbit. Why did he learn to be afraid of a rabbit? Probably because, very similar to little Albert, he associated the rabbit, which was probably a neutral stimulus, with something that was very fearful. Okay? Now, after she brought the rabbit into the room, next she had Peter eat his favorite snack. What she wants to do is have Peter associate the rabbit with a new conditioned response, which in this case is simply the pleasure of eating his favorite snack, which are cookies. Now, while using observational learning, she was able to have Peter associate the good feeling of eating a snack with holding the rabbit. So she replaced the established conditioned response, which was maladaptive, which was fear, with a new conditioned response by simply associating the rabbit with something other than, a bad stimulus, which probably was the case in this one. Now, who conducted the first research to the technique of counter-conditioning? Most of you should remember that. Stands out. Mary Colbert-Jones. Now, systematic desensitization was simply developed by Joseph Wolf. Now, he developed this to treat phobias and other anxiety disorders, which involves the gradual learning of a new conditioned response. Okay, so this is an extension of Mary Colbert-Jones' work. Now, the basic thing is the new conditioned response, or the new CR, is going to replace the original CR. All right, which was obviously, let's say in this case, fear. Now, systematic desensitization is a process, okay, that you can see right here, nicely wrote out for you guys. Now, number one, patient experiences progressive relaxation. Okay, this is the process. Okay, throughout the body in the presence of a fearful stimulus, as he or she is taught to relax each muscle of the body. So step one is they're teaching the person how to calm their body down. So in other words, how to get their parasympathetic nervous system to be active. Step two, patients are then asked to generate a list of all negative things associated with whatever they're afraid of. Okay? This is called anxiety or desensitization hierarchy. The patient is also asked to imagine a relaxing scene to be used as a control scene. So in other words, to think of a happy place, like in Happy Gilmore. All right? Or to imagine something that's very relaxing, sitting on a beach, okay, or sitting in Mr. McLean's lecture. Now, the actual process of desensitization involves having a patient, while relaxed, remember they were learning relaxation techniques, this is eventually going to be their new CR, all right, is relaxing instead of becoming scared. Scared is the original CR. Now, they first imagine the least stressful image on the anxiety hierarchy. Then, as long as relaxed, they go to the next image. They progress from the least stressful to the most stressful, image. Now, the whole time, they are simply using the relaxation techniques they use with each scene. Now, if the therapist notices that they get a scene, or they get to a point in the hierarchy that causes too much anxiety, they then go backwards, and then they start over. In other words, they're trying to replace these original conditioned responses with new ones. Now, the control scene has become the new conditioned response. So in other words, when they see a snake, instead of getting scared, they imagine or they associate a beach, or sitting on a beach with the snake. Now, observational learning is also used because they will watch other people with the snake, seeing that they don't have any problems, experiencing no problems, and that will help them along this process. Now, virtual reality graded exposure, which is kind of the recent application of systematic desensitization, allows clients to experience their fears in a controlled computerized setting. without real world context. So literally they're in like a virtual reality. Now, exposure techniques is direct exposure to the feared image or event in a controlled setting. Basically what this is, exposure technique is, remember that anxiety hierarchy. So they went from least stressful to most stressful. Exposure therapy goes to the most stressful scene right away. So in other words, if their most stressful scene is holding a snake, they have a snake that's pretty much put right on top of their lap. Now sometimes this works, but sometimes it backfires, which is often why people sometimes will not do this, because if it did bring on a very strong panic attack, then obviously exposing the person to it is not the best thing to do. Now, typical question. Facing a fear in a controlled and non-harmful manner is an example of, and most of you would say, that's exposure therapy. Okay? Now, aversive conditioning involves pairing a harmful stimulus with an unpleasant stimulus, or a distasteful stimulus. When a person takes, for example, disulfiram, which is a drug used in aversion conditioning, and then consumes alcohol, he or she ends up nauseous or vomiting. Now, the purpose is to have the patient associate the nausea, which would be the conditioned response, with alcohol. Originally, what they had associated alcohol with is something pleasant. That's why they drink. They like to be, have alcohol in their system. So if you put this pill in their system, they take a sip of alcohol. What will happen is, when the pill immediately, mixes with the alcohol, they'll vomit all over the place. And what they want that to be is the new conditioned response. Now, behavioral therapies that emphasize operant conditioning. Behavior modification uses operant conditioning principles and is based on the premise that the consequences, in other words, how you operate, depends on what follows. The action or the behavior will have a big influence on the way you act in the future. Now, behavior modification believe that maladaptive behavior can be modified through consequential actions. Again, positive reinforcement is the presentation or the addition, of a pleasant stimulus after a desired behavior. Now, an example of positive reinforcement would be token economics or token economies. A person is given a token after a desired behavior. Now, they can later exchange these tokens, for things that they want, like magazines or, different types of clothing. Extinction, another operant technique, is used to stop undesirable behavior through non-reinforcement. Now, we didn't really cover this in Chapter 8, but simply a kid screaming wants attention. That's their reinforcement. That's what they want. So non-reinforcement is you just ignore them, and hopefully the kid will stop screaming or throwing a temper tantrum. So teachers will sometimes do that. They just ignore the kid because they know the kid is just mouthing off because they want attention. You give them non-reinforcement, that temper tantrum will become extinct. Now, typical question. In certain rehabilitation centers, patients are given coupons for good behavior that later can be used to buy desirable merchandise. So they're given tokens. So the example of that is letter D, token economics. And really, token economics are used in a lot of times, rehabilitation centers or drug treatment centers. Now, the third type of behavioral therapy is called cognitive behavior therapy. Cognitive behavioral therapy utilizes learning principles to change people's thoughts. Thoughts being cognitive. So in other words, what cognitive behavioral therapy believe is your actions affect your thoughts, and your thoughts can affect your actions. Now, Albert Ellis developed rational emotive therapy called REBT, and it's based on the belief that distorted expectations and irrational beliefs continue to psychological disorders. Simply looking at this chart, and I kind of agree with what Ellis said, is that it's not the event itself that causes depression, which is the consequence. It's the beliefs that lead to depression. So in other words, the individual can't find a date to prom. That's the event. Their belief is, I guess nobody likes me enough to ask me to prom. It's the belief that leads to feelings of depression. Because some people have different beliefs why they don't go to prom. Some people might not go to prom because, for example, their belief is everyone must think I still have, a girlfriend. That's why nobody asked me. That's more of a positive belief. This negative belief, which would be a pessimistic. Remember pessimistic, they attack their personality. That's what's responsible for depression. So what REBT therapy aims to do, they can't change the event. They can't find you a date to prom. What they're going to do is change your negative beliefs. Once they change the negative beliefs and are more productive, that will lead to a different consequence rather than depression. Now, what factor would Albert Ellis agree could potentially contribute to a psychological disorder? In the ABC model that we just went over, Most of you would say yes, that's the belief that's around the event, which is letter D. Now, cognitive therapy, okay, is a little bit different of a version than REBT by Ellis. Beck originally trained as psychoanalysis and again got away from the unconscious mind. Came up with what was called CT therapy or cognitive therapy, which is based on the idea that people have developed cognitive distortions, distorted perceptions and interpretations of events that have contributed to psychological disorders. He believed people blow things out of proportion more than anything. Now, CT is a more direct approach than Ellis's therapy. And it is basically, they're not only taught to identify negative thoughts, but they actually go out and test those negative beliefs. Now, if you've ever seen the movie Anger Management, when Jack Nicholson had Adam Sandler actually go out and ask somebody out and test that belief, that's what CT therapy does. CT therapy is let's see what happens. They actually put you in situations to test your beliefs. REBT therapy more discusses it. This is why you're feeling depressed, because you think that nobody likes you. This is going to say, well, if you think nobody likes you, let's go out and actually test it. Okay, and that's CT therapy. Now, the client is then told to build on the positive experiences and addressing the outcomes. And we'll talk a little bit more of that with some more examples in class. Now, who would suggest that cognitive distortions or errors in logic that are blown out of proportion? In other words, people basically have the worst beliefs and they blow every little thing out of mind. That would be Aaron Beck. Okay? And Aaron Beck, a good way to remember it is he'll bet you that you're not as thinking distorted as you think you are. Now, group therapy, which incorporates obviously a group, many humanistic ideas. The good thing about group therapy is it's cost effective. The other thing is you compare yourself to other people. Once you see that other people have similar problems that you do, you'll be more understandable that you're not all alone in the way you think or the way you act. Now, you can also get support from group therapy. Group therapy is really successful in dealing with people with similar problems. Okay, and often you will think of two examples that come together with group is Alcoholics Anonymous, Gamblers Anonymous, people that can see that they obviously have something in common with other people. Now, which form of therapy tends to be cost effective and involves the interaction among several people? Most of you right away would say that's letter E, group therapy. Now, family therapy and marital or couple therapy are two examples of group therapy. Family therapy is the aim is to show how each member affects the other member. Most of the time, most of the problems that exist in a family are because the other people in the family don't respect the other individuals. They think that they're more important than their brothers or sisters or things like that. So the aim of family therapy is simply to make you aware that there's other people in that house except you. Marital therapy, the big aim is communication. Most people that have marital problems are simply just don't talk to each other about them. It's possible to be in a marriage and not simply to discuss anything and to ignore each other and pretend everything's okay. Now, evaluating psychotherapy approaches. A meta-analysis, which is a term you could see, gathers large amounts of information from a variety of sources and then presents it in a single report. Now, findings include that if a person wants to go to therapy, a person's going to be better off in simply getting the most out of therapy. Now, cognitive behavior and interpersonal therapy are effective for treating depression. Cognitive behavior exposure therapy is good for treating phobias, panic disorders. Now, behavior modification is good for treating, bedwetting, substance abuse problems, and so on. And psychoanalysis is often good with personality disorders and substance abuse. All right, biomedical therapy uses drugs and medical procedures to treat people. Often they're going to work with people that have psychotic symptoms, neurological traits, genetic, predispositions. Psychosurgery involves destroying tissue and regions of the brain for treating psychological disorders. Very rarely this is done anymore. Now, Egas developed a procedure called the prefrontal lobotomy. Now, this is not used as much as people think that it is. If you ever saw the movie, it's escaping me right now, when they performed, Shutter Island, they performed a lobotomy at the end. Basically it's involved, you take an instrument, put it through the orbital part of the eye, and then simply destroy all the neural connections in the brain. Well, when you destroy the front part of the brain from the rest part of the brain, you're left with somebody that's almost a zombie. That's why it's very rarely used anymore, because it's irreversible. Now, ECT, or electroconvulsive therapy, is used for severe depressive patients. And again, it's very, very rare that it's used, but it's a brief electrical shock that is thought to stimulate the action potentials between neurons, okay, which allows more communication. Now, it's sometimes used with, or it's mostly used with depression, but it's also sometimes used with schizophrenia. ECT is very risky. It can be linked to seizures, memory loss, speech disorders, and another problem is, and this is the major problem, is short term. You know, you can excite the neural activity, but after a while the neural activity will remain back into a kind of a low type of atmosphere. Now, prefrontal lobotomies are an example of which type of therapy? Again, it requires surgery, so that would be psychosurgery. Now, some of the drugs that are used, neuroleptics, or antipsychotics as they're better known for, have been used to treat psychotic symptoms. Primarily, the positive symptoms of schizophrenia. So they're used, neuroleptics, or antipsychotics, are used to treat hallucinations, okay, disordered thinking, confused speech. Thorazine and Hopidol are the most common used neuroleptics, which often affect the levels of dopamine. Remember, from the previous chapter, excessive dopamine leads to hallucinations. The problem is with these drugs, they have major side effects. One of the major side effects is tardive dyskinesia, which is an irreversible movement disorder that's similar to Parkinson's. Remember, a lack of dopamine leads to Parkinson's. So when people take Thorazine, yeah, it stops or it simply reduces the amount of dopamine activity, but when it reduces it too much, then you produce, Parkinson's, Parkinson types of symptoms. Now, the newest antipsychotic disorder, clozapine, has been more successful at treating the negative symptoms. Remember, negative symptoms are what you're missing. That's your emotion, that's your speech. Now, on the next page, tardive dyskinesia, which you probably will get a question on very much in this class, was associated with which type of psychoactive drug? That is, again, neuroleptics or antipsychotic medications. Now, antidepressants are used to treat depression, okay? And they increase the amount of neurotransmitter serotonin. Remember, serotonin is in charge of mood. So people that have instability mood, serotonin will help. And norepinephrine. Norepinephrine arouses the body. But often, it takes weeks for antidepressants to take effect. Now, the first generation were called male inhibitors, but they had side effects like weight gain and dizziness, and people didn't like taking them. The newest are selective serotonin reuptake inhibitors called SSRIs. Now, they do not act on multiple neurological pathways, but focus on serotonin. That's why I call it selective serotonin. Now, what these SSRIs do is they block the reuptake process of serotonin, allowing it to stay in the synapse, which is the gap between neurons. This staying in the synapse longer results in it being used again when the neuron fires. So in other words, people that have sometimes genetic links to depression, what happens is the serotonin gets sucked back by the sending neuron before it has a chance to do anything. So simply what an SSRI does is slows that process down and allows the serotonin to be used, and in other words, to have an effect. Now, some of the more common SSRIs are Prozac, Zoloft, and Paxil. Now, newer SSRIs are dual-action antidepressants, in fact, as well as not only serotonin, but norepinephrine as well. Now, anti-anxiety medications are called anxiolytics, are prescribed to people with anxiety disorders. And these are always fun to pronounce, benzodiazepines, which include Valium, are the most common prescribed. Now, these drugs increase the level of the neurotransmitter GABA. Remember, GABA is a neurotransmitter that slows down brain activity. So if somebody doesn't have enough GABA, they are going to experience anxiety. And Valium basically, what we'll do is simply boost the effect of GABA. Now, these drugs are highly addictive. That's the major problem. And often will affect alertness. Okay? The problem is people tend to have a tendency to drink alcohol with them. And now you can remember, Valium slows down brain activity. Alcohol does the same thing. You combine them, it could lead to death. And some of the famous actresses and actors have died from simply having Valium in their system as well as alcohol. Now, on the next page, lithium is used to treat bipolar. Now, lithium is a naturally produced substance that affects both the manic and depressive symptoms. Now, lithium has been effective at controlling glutamate, which produces excitatory effects on the brain. So obviously, somebody who experiences mania, that's because glutamate simply excites the brain. So this kind of downs that a little bit. Depakotate is an anticonvulsant medication, which is a new alternative to lithium to treating bipolar. Now, Which drug has been used, as an alternate to lithium for treating bipolar? Most of you, that's depakote, which is the newer generation. Now, the last part, evaluating drug treatments, that's kind of a controversy. Some people believe that drugs are overprescribed. Some people believe that people are taking drugs that shouldn't be taking drugs. The bottom line is, and this is more my opinion, is that some people need to be on certain medication, okay? Because it's nothing of no fault of their own. It's just their brain operates in a different way than others, okay? It's often best if it's used with psychotherapy. The last slide, community psychology. Deinstitutionalization is a major problem in this country's history of treating mental disorders, right? And it basically was the closing of hospitals and shutting down funding to mental programs. The problem was you had people in these hospitals, and when you shut these hospitals down, you kick these people out into the streets with no medication and no forms of treatment anymore. As a problem, many of the homeless people that wander the streets of major cities are, psychotic, or they are suffering from other psychological disorders. So in response, community psychology is a movement to prevent psychological disorders by going into poverty-stricken areas and providing help to people who otherwise can't get it on their own. Now, these psychologists reach out, like I said, to the homeless and provide care. So they're often working at shelters, shut-ins, hospitals that are within local areas. All right.